What do I recommend for testosterone? So I have a lot of patients who come to me with low testosterone levels. I think testosterone is probably the most important hormone for both men and women. Helps with energy, fatigue, brain fog, libido, all that stuff, lean muscle mass, right? It's really, really important. It's a motivational hormone. How do I treat this? So the first thing I do is address lifestyle. We got to get your sleep good. We got to get your blood sugars balanced. We got to make sure you're eating a good diet. We got to get you in the weight room, and we got to make sure your stress is managed. So those are the first things. Yes, I prescribe TRT. There's lots of ways to do that. But the other things that we do is GLP-1s, right? We know that there's an inverse relationship between higher blood sugars or insulin resistance and lower testosterone levels. So if we optimize your blood sugar insulin resistance using certain peptides or other dietary modifications, your testosterone level will come up. Weight loss, you'll see usually an increase in testosterone levels be between 200 to 250, I think is the latest research on that. So ways to increase testosterone.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.